Hi everyone, Danny here. Today we have Dr. Chris Bishop in to talk to us about matters relating to limb asymmetry and how it can affect sports performance. Dr. Bishop is the program leader for Masters of Strength and Conditioning at Middlesex University, and he's also the chairman of the board of UK Strength and Conditioning Association. All right, let's get going. Okay, thank you everyone for watching. Today we have Dr. Chris Bishop from Middlesex University to talk to us about matters related to limb asymmetry. Thank you, Dr. Bishop, for coming in.
Thank you very much for having me, Danny. It was very nice to be asked, and it's a real privilege. So, thanks again.
You're one of the more prominent researchers on limb asymmetry matters. Yeah, so it would be great to have your inputs on how all this, your inputs on how limb asymmetry will be affecting sports and how we can deal with it and stuff like that. To begin with, what are the type of tests that let's say in an ideal situation whereby we are not limited by equipment, what's the best way to test for limb asymmetry for both lower or upper limb? And
sure. Oh, sorry, go on. Sorry, go on.
And how would you consider, what magnitude of difference would it be of concern to us?
Okay. Questions are really, really important one, actually. I mean, what we know about the topic for, virtual certainty is that asymmetry is very task and test and metric specific, So if you were to measure or calculate jump height asymmetry from a unilateral jump, and you did it on a force plate, you could also calculate force and impulse and power asymmetry, right? Because assuming you have separate data for left and right leg, you can just subsequently calculate an asymmetry thereafter. What we know from that is that if you got 6% limb difference for jump height, you almost certainly wouldn't get 6% for the other metrics. So it's very, very metric specific within the same test. So that brings to light that we need to be really, really clear which metrics we're monitoring and why. And then that relates back, if you go back a step, that relates back to the test as well. I've always said for many years, really, we shouldn't be looking to implement test protocols because we want to measure asymmetry. We should only look at asymmetry because it's a consequence of having the data that's aligned to the appropriate tests we use. So what tests should we use? The answer to that really is probably still down to what tests do you need to perform to determine, baseline markers or assess athletic qualities in your athletes. So if you work with basketball or volleyball athletes, then jump testing is almost certainly going to make its way into your protocols. If you work with a more strength-orientated athlete, like a powerlifter or a rugby player, then, strength testing, we might find might be more prevalent in our testing battery for those types of athletes. So the key for me is make sure that your tests reflect what your athlete needs. And we determine that by understanding the needs and the demands of their sport and them as individuals. And then consider looking at asymmetry thereafter, whether that be in a strength test, a jump test, a change of direction speed test, whatever it might be. And then in terms of the magnitude, this is a bit of a hot topic of sorts, really. And sort of some of the more dated literature has tried to tell us that 15% is a threshold for potential risk of injury, and more recently, potentially 10%. But if we know that asymmetry is very metric specific, like we gave that example we gave earlier, You know, if I have 6% for jump height, I'm probably not going to have 6% for the other metrics. Then if you know that it's important for a coach to monitor jump height, but as a practitioner, you're also interested in monitoring impulse and maybe RSI mod as an example, and you can get asymmetry data for all of them, then if you're expecting different magnitudes for each metric, it's virtually impossible to apply one blanket magnitude or threshold that we need to be concerned about. Now, I've just reviewed a paper in the Strength and Conditioning Journal, which has proposed, it's kind of a response to my, are thresholds a usable concept paper that I recently published in SCJ. And it's a really good paper, and I've recommended publication for it. I think the journal's about to make a decision on that paper. So one way we could look at it is by using, is to try and contextualize a threshold relative to your sample that you work with. So if you work with a set of 20 soccer athletes and the average asymmetry is 10% across the group, that's just an average. And what we always find is that the standard deviation is really, really big for asymmetry, because asymmetry is a ratio, and a ratio tends to be a noisy metric because it inherits error from left leg and right leg, and then it compounds it by putting it together into one value. So what we could do is we could look at creating a threshold relative to the group mean. So one way of doing that would be to take the smallest worthwhile change of your average. So take 0.2 times the standard deviation and then add that on to the group mean. So, your threshold now becomes 12% for your sample. So that, as an example, and the reason for that being that, anyone above your group threshold, which you've calculated via the smallest worthwhile change, might be considered asymmetrical or high asymmetry, and anyone underneath that threshold value that you've calculated, which is relative to your sample, can be considered sort of within the group norm of asymmetry. So I don't think blanket thresholds hold much use for practitioners, especially when you've got this noisy concept. But the concept of calculating higher or lower asymmetry within your own set of athletes is probably quite useful. Something I actually haven't considered doing much myself. And these other authors, whoever they are, have proposed something really good, because it's a way of practitioners understanding how to use asymmetry data within their own sample. And it's the same calculation each time, right? So if you turn out that you get a different asymmetry value next time you test on the same metric, you can still run the same calculation and subsequently see if your players are kind of swapping their rank and their place. Like, do they always remain highly asymmetrical, or do they always remain within their normal asymmetry threshold of that particular group? And I think that's one way of helping practitioners understand how to use a threshold. But I would definitely be mindful of applying any blanket threshold like a 10 or a 15% to everything, because it's a highly individualized concept. And we've seen that from if you have asymmetry data, or any practitioner has asymmetry data, I just encourage them to just scan the asymmetry column down their Excel spreadsheet or wherever they record it, and just look at the difference in the magnitudes. I can virtually guarantee that some of their athletes will have a tiny asymmetry and some will be enormous. And there's a constant range with asymmetry, it seems, because it's quite a noisy ratio concept.
Is there a strong correlation between, say, a high asymmetry with common activity like sprinting and running performance?
Not really is the answer. Some of our studies have found meaningful correlations, between an asymmetry index and some sort of locomotive-based task like sprinting or change of direction speed. But I'm pretty critical of some of our early work now, actually, having completed the PhD. And the reason for that is we've been running correlations or associative analysis just with outcome measures of those locomotive tasks. So just looking at how fast you run or the total time to complete a change of direction speed task. So, you know, we know from jump testing, it's important to look at strategy, not just outcome measures. And effectively when we run a correlation between asymmetry and time in a speed or a COD test, we're again just only looking at the outcome measure of the locomotive task. And the correlations that you find are pretty hit and miss. You know, you don't always find anything meaningful. It's pretty erratic. And I just think that comes down to the fact that asymmetry as a concept is noisy. And if asymmetry is noisy, that means that it's hard to replicate the same results and findings when you repeat your procedures, because there's kind of a lack of consistency, you know, in each individual's scores, in each individual's data, asymmetry data, that is. And that's certainly what we found in my PhD. You know, we had a lot of longitudinal studies throughout my thesis. And what we found is that from all the single time point studies that were conducted prior to my longitudinal ones, there's lots of evidence to show that asymmetry is detrimental to some kind of independent variable, but it's only been detrimental at that single time point. And when we looked at repeated time points and longitudinal monitoring, the consistency in those relationships just weren't there. So I think it's really, really important to try and understand that if you look at a correlation, first and foremost, that doesn't mean causation, you know. And the second thing to look at is probably how consistent is that relationship. You know, we're always interested in looking at reliability from a within session and a between session standpoint, you know. So are my test measures reliable between sessions? And I kind of wonder why we're also not interested in looking at relationships between sessions, you know. Why looking at a correlation for a single time point doesn't really tell us a great deal, in my opinion. If you started seeing consistent relationships over repeated time points, maybe then that is telling you something from a practitioner's perspective that you need to investigate.
In that case, would an athlete having a large asymmetry even be a concern to you right now, that you feel that?
Yeah, it's a great question. I guess it's a two-part answer. The evidence in my thesis said no, because we had sort of elite soccer players measuring asymmetries from jump testing across various different metrics and different jump tests, about 30 or 35%, and they weren't getting injured all season. So they remained healthy throughout the entire season, you know. And historically, the literature would tell you that if you have a percentage difference of 30%, you know, it would be, oh, this is terrible. I'm not sure that my evidence from my thesis doesn't say that. So typically, no, at the moment. However, if you look at the sort of overarching evidence base for, correlational analysis between asymmetry and independent measures of performance, there is the largest consistency in results across studies is for strength-based tasks. So what I'm saying is, if someone has measured strength asymmetry in, you know, a back squat on twin force plates, or, you know, unilateral mid-thigh pull or unilateral isometric squat, and then tried to compare that asymmetry index to some independent variable and look at a relationship. Actually, most studies which have measured strength asymmetry report a correlation that suggests there's, you know, a negative association with performance. So with that in mind, I think there is something in strength asymmetry, probably less so in things like jumping and cod tasks because they're much more variable. And if they're much more variable because of the dynamic nature of the movement, that means that it's hard to replicate the exact same outcome each time, you know, and we're starting to get into this concept of movement variability now, aren't we? Whereas in a strength task, particularly isometric strength tasks, because there's no movement and they're more stable and they're probably more replicable and easier to repeat, it's potentially easier to find the same result from an asymmetry perspective, and therefore a true asymmetry in strength might, you know, or always be there, and maybe then that's potentially detrimental or indirectly detrimental to performance. I think there's about 8 studies now that have measured asymmetry in a strength task. They've done a correlation between strength asymmetry and an independent variable, and 7 out of 8 say that there's a negative effect on performance of some kind, which is only 8 studies, but you know, we're talking about sort of 92% of those studies showing or reporting, you know, similar findings. So I think it's probably that if asymmetry is a problem, maybe it's a problem only within specific physical characteristics, and strength might be one of the key factors there. And if you think about that logically, so if we step away from data and think about a coach's perspective, if I work with a soccer team and I see a large asymmetry on a player who plays, you know, out wide on the wing, what we want to know is that asymmetry there because they constantly play wide and therefore they always need to cut off the same leg in field? Or is it just there as a consequence of, you know, constantly changing direction and one limb being substantially weaker than the other? Now, I think the point is not so much that the asymmetry is detrimental to their performance. It's probably more that if you have one limb substantially weaker than the other, then if that limb has to do more work or undergo more load during competition or a match that it isn't used to doing, we're probably going to breach its tolerance capacity earlier, and therefore you're potentially predisposing an athlete to greater risk of injury. So it's maybe not that the asymmetry itself is the problem. Maybe it's just that if I have one limb that is constantly and consistently weaker, maybe if it has to do more work than it's used to, it's more likely to get injured. So we kind of now see that I'm kind of less worried about this gap, and I'm just more worried about improving the weaker limbs' capacity to do more work, if that makes sense. And if you improve the weaker limbs' capacity to do more work, this gap will probably start to close up naturally anyway. Does that make sense?
So in that case, have you had much experience with getting athletes with high asymmetry to kind of lower the gap between that asymmetry?
Yeah, I mean, we've done, again, it's another sort of complicated answer, sorry. We've done a few training interventions, you know, sort of 6 weeks, 8 weeks, 12-week interventions where they train once or twice a week, and then we measure, you know, how asymmetry changed pre and post intervention. And sometimes asymmetry reduces, sometimes it doesn't. I think, generally speaking, the evidence so far would indicate that both unilateral or, you know, bilaterally asymmetric and bilateral training can reduce asymmetry. That both methods can work to reduce asymmetry. It doesn't always work. To then follow on with another question of, well, why doesn't it always work? I think just again relates back to this concept that asymmetry is so noisy. You can't always guarantee that if an individual athlete measures 10% asymmetry before an intervention just because they trained doesn't mean that the asymmetry is going to come down to 2 or 3%. You know, it's a variable concept. You know, we will find that after training interventions, some athletes actually increase their asymmetry slightly and some do decrease. There's probably a general trend to reduce asymmetry after you train, but there's a really, really nice study by, I think it's Caleb Bazir, who's part of Mike Stone's group, from 2014. And it was just 20 recreational athletes, and they did a 7-week back squat training program twice a week, and they divided the group into strong and weak, and the strong group are up sort of near 2 times body weight squat, as you'd expect from a Mike Stone group, and the weak group were about 1.55 times body weight. And now both groups started with low strength asymmetry, but the weak group, not only did they increase their 1RM, as both groups did for the squat, but actually their strength asymmetry significantly reduced. Okay, so, and that was training just a back squat twice a week. So I think that the message there is probably, if you just train consistently over time and just work on getting stronger and more competent in the weight room, your asymmetry will probably naturally start to just reduce anyway, just with consistent training. And I think that's a fair statement to make, even though I've only cited one study, because, you know, training is a process, isn't it? You know, it takes time. We know that as practitioners. And I think just the more consistently you train and the stronger you become, and the more athletic you become, you know, you're probably going to naturally reduce that limb difference over time anyway. So that's probably the main message, really, rather than looking for any specific strategy to reduce an asymmetry immediately. Not sure that that's the correct answer, because I think even if you were to reduce an asymmetry immediately, you wouldn't get the same results over time because it's so variable.
One question that will be of great interest to us, because we have our record sports athletes are probably one of the best performing athletes. So we're always thinking, for record sports, they're always having a really dominant side, and the other side is pretty much useless. And we always wonder, is it good to get them to be more symmetrical, or do we just let them be more asymmetry? What's your opinion on that?
Yeah, I mean, I will start the answer by saying it is only an opinion, what I'm going to say, because I don't have lots of experience working with racket athletes. But, you know, I think there's a lot to be said for this notion of, I don't particularly like the term, but, you know, functional asymmetry. The asymmetry is there because it's a consequence of their sport. You know, there's a really nice paper from, I think it's 2016, from Nick Hart at Edith Cowan University, which basically just says asymmetry is a product of, you know, competing in a single sport over time. You know, if you do the same movement patterns over and over again, you're going to expect to develop imbalances. For racket-based sports, you know, the first thing that immediately springs to mind is something like tennis and Rafa Nadal, who used to have just such a huge left arm, didn't he, compared to his right. And that's, like you say, that's probably a consequence of the sport that they play. Do you gain anything by trying to rectify that imbalance? Probably not. No, I think, I mean, I also don't have masses of experience with upper body asymmetry. There's a guy in Belgium doing his PhD on upper body asymmetry in tennis at the moment. But I would be surprised if you saw an improvement in match performance, however you measure that, for racket-based athletes if you try to minimize that imbalance, really. I think that's just a consequence of the sport that they play. The one thing you can be mindful of potentially is rather than interlimb asymmetry. So trying to compare dominant to non-dominant or right to left. One thing you might want to look at and consider is intra-limb asymmetry. You know, so for racket-based sports, trying to compare sort of internal rotators versus external rotators. So intra being within the same limb. You could look at those types of imbalances. That's probably more of a concern for racket-based athletes, you know, is rather than trying to make my weaker arm catch up with my stronger arm, maybe it's trying to promote sort of good balance and equilibrium in the musculature and the functioning of that musculature within the same side, that dominant side that's constantly being used, if that makes sense.
Yeah. Great. Thanks a lot for all these insights. Yeah, that's pretty much all the questions we have for you today. Yeah.
Thank you very much. It's been an absolute pleasure, and really appreciate being asked to come on. Thank you.
Thanks a lot. I'll see you again next time.
Bye-bye.
Bye. We've come to the end of the video. Thank you for watching. I hope you'll find the conversation insightful. Thanks. See you next time.